I'm Melissa. I was diagnosed with triple negative breast cancer at the age of 33, and I went through my journey at Western Health.
And I'm David, and this is our son Louis.
So I was about 33 weeks pregnant when I had noticed something quite unusual in my right breast. I did my ultrasound, we visited the GP to get the results, and then we were referred to Dr. Elaine. We found out at approximately 35 weeks that I had triple negative breast cancer, quite advanced, with the lymph node involvement. We were just preparing to be new parents. We just moved into our new home. We wanted to enjoy what that could sort of look like. I think the biggest thing was you'd always hear that cancer was for somebody else, whether it be someone's friend, family member, someone in the distant community. You didn't think that cancer would affect you personally. I think the unknown was the biggest challenge. It was, will I survive? That will always be at the back of your mind. And I just had a son or a newborn, and I wanted to be there for him, for my family, for my friends. And then you just sort of go into that survival mode and all the thoughts run through your head.
My name's Dr. Elaine Moreira, and I'm a specialist breast and general surgeon working at Western Health. The first person that the patient meets is the breast surgeon, so myself, and I think that's a really key time to build a rapport with the patient. That was a tough day. I remember that day like it was yesterday. Obviously, I knew the results of her biopsy. I'd met her once before, so this was the second time I met Dave and Melissa. She was in complete shock, and physically she was shocked. Her main concern was very much whether she was going to survive this diagnosis and therefore be able to birth a healthy baby boy and be there as a mother. I spent as much time as Melissa needed to reassure her that the care at Western Health would be the best care that she would receive. My main priorities obviously were to ensure that her mental, emotional and physical well-being were at the forefront of this whole journey.
These donations are particularly important because they do help with advances in technology, and in my instance I was fortunate enough to have used the Scout technology, and that enabled my surgeon Dr. Elaine to precisely go in and remove that tumour with the aid of the Scout machine. And your donations don't just help me, they help anyone else in my position or any other woman.
The Scout machine has really revolutionised the way that we treat breast cancers. Raising funds for an extra Scout machine at Western Health is paramount. We have seen approximately 240 new breast cancers in our service in 2025. So I think that really highlights how important it is to have extra resources and extra funding to ensure that our patients receive the highest standard of care. We often have 2 concurrent breast operating lists at Sunshine Hospital, which means that only one Scout machine can be in use at any one time.
I am very grateful for your donation because it's given me the opportunity to continue to live my life. I didn't think I would have that future ahead of me, but I'm very grateful to have, and your donations will continue to help others in my position as well.